The adult choking patient can typically be identified by the universal sign for choking. When responding to a potential choking, first approach the patient and introduce yourself as an EMT. Ask the patient, "Are you choking? Can I help you?" A patient with a complete airway obstruction will not be able to answer verbally. If the person is unable to cough or shows signs of complete airway obstruction, tell the patient you are going to conduct the Heimlich maneuver. To perform the Heimlich maneuver, position yourself behind the patient. Place one foot between their feet to support them in case they lose consciousness, and brace yourself with your other foot. Wrap your arms around the patient's abdomen and place one fist, thumb side in, just above the patient's navel, but below the xiphoid process. With the other hand, grasp the back of that fist and deliver abdominal thrusts with quick inward and upward motions. Continue these abdominal thrusts until the obstruction is dislodged, and stop immediately if the patient becomes unconscious. If the patient is pregnant, or if you are unable to reach around the abdomen, you can modify the procedure and perform chest thrusts. If the patient loses consciousness, lower them to the ground, open their airway, and look for foreign objects or other obstructions, like lodged food. If you see the obstruction, remove it immediately. Be careful not to push the obstruction deeper. If the patient remains unresponsive and is not breathing, immediately start CPR, cardiopulmonary resuscitation. If the choking victim is a child, use the same procedure with one modification. Kneel down to the height of the child instead of standing.